You've probably heard about breast self-exams your whole life, right? But lately, the advice has gotten super confusing. So today, we're going to cut right through all that noise. We're talking about the new approach, breast self-awareness. Let's break it down.
All right, let's just tackle the big question head on. Are breast self-exams actually helpful, or could they be harmful? For a long time, we all thought we knew the answer. But, as science and medicine evolve, a lot of us are left kind of scratching our heads, wondering, what am I really supposed to be doing here?
And that's exactly what we're going to clear up right now. We're going to walk through what the experts are saying today so you know exactly what the deal is.
Okay, section 1. So why did this whole message get so messy? Well, it wasn't an accident. It was actually a really big, deliberate shift from some of the most respected names in medicine. So what's behind the change? Well, a huge part of it comes from groups like the American Cancer Society. They actually stopped recommending routine monthly exams. Why? The biggest concern was the risk of false results. Think about it. A false positive, where you find something that turns out to be totally harmless, can cause a ton of anxiety and lead to procedures you just don't need. And maybe even more dangerous is a false negative. That can create this false sense of security, making you think you're fine, and maybe delay a screening that you really, really need.
So that led to a whole new way of thinking, one that's way more empowering. The focus shifted away from this rigid, formal exam and moved towards something more holistic, the idea of awareness.
But what is breast self-awareness really? Well, it's this concept that's now promoted by major groups like the American College of Obstetricians and Gynecologists. And here's the key. The goal is not for you to play detective and hunt for problems. Nope. It's simply about getting to know your own body, your own normal, understanding how your breasts typically look and feel, throughout the month. Because that familiarity, that's what makes you the expert on you. You're the one who's going to notice first if something just doesn't seem right.
And this slide really nails the difference. The old way was all about that strict monthly exam, right? The focus was on hunting for lumps, which kind of turned all of us into amateur doctors trying to diagnose ourselves. The new way? It's about ongoing awareness. The focus is on just knowing you're normal. And the goal isn't diagnosis, it's simply noticing changes. It seems like a small tweak in wording, but it's a huge psychological shift, from anxiety to empowerment.
All right, so what does this actually look like day to day? How do you do it? Let's get practical. We're going to walk through a really simple 3-step guide to help you build that awareness.
It all boils down to these 3 simple steps, and they're designed to give you a really complete picture. First, a visual check in the mirror. Second, a physical check while you're standing up. The shower's great for this. And third, a final physical check while you're lying down.
Okay, step 1, the visual check. Just stand in front of a mirror. First, look with your arms down by your sides, and then with your arms raised up over your head. You're not looking for anything specific, you're just observing, getting familiar. You're noticing the general shape and size, looking for any changes in the skin, like dimpling, and just taking note of the usual color, texture, and shape of your nipples.
Step 2 is the physical check while you're standing. A lot of people find the shower is the easiest place to do this, because the soap and water help your fingers glide really smoothly. The trick is to use the pads of your 3 middle fingers, not your fingertips. You'll want to use different levels of pressure, light, medium, and then a little firmer, in small circular motions. And make sure you cover the whole area, the entire breast, and all the way up into your armpit.
And for our last step, we're doing the physical check while lying down. Now, this is a great position because it helps the breast tissue spread out evenly, which can make it easier to feel what's going on. So to check your right breast, you'd lie down, pop a pillow under your right shoulder, and put your right arm up over your head. Then, with your left hand, you just do the same thing. Check the entire breast and underarm area using that light, medium, and firm pressure. You can also give the nipple a gentle squeeze to see if there's any discharge. Then, you just switch sides and do it all over again for the left.
Okay, so you're building this awareness, you're getting to know your normal, but what kind of changes are we actually talking about? Let's break down the specific things you might notice. First, let's talk about the breast tissue itself. A change might be a new lump, or maybe just a thickening that feels different. It could be a change in the overall shape or size that you can't explain. On the skin, you might notice dimpling or puckering, or maybe some skin that's suddenly irritated or scaly. And of course, any unusual swelling or even a new pain or burning feeling, those are all things to be aware of.
Next up, the nipples. A change to look for here could be a nipple that starts to turn inward when it didn't before, or any new changes to the skin's color or texture. Also, pay attention to any new warmth, swelling, or tenderness. And, this is a big one, any discharge that isn't breast milk, whether it's clear, yellow, or even has blood in it, that's definitely something you'll want to get checked out.
And it's not just about the breast itself. Your awareness should extend to the areas around it. Sometimes, the very first signs can show up in the lymph nodes nearby, so just be mindful of any new lumps or swelling in your underarm area or even up around your collarbone. A thickening of the skin in your armpit is also something to note.
Now, a little context here is super important. Swollen lymph nodes are really common. I mean, it can just be a sign your body's immune system is working hard, maybe fighting off a cold or reacting to a vaccine. The key word is unexplained. You're looking for changes that don't have an obvious reason and that stick around. And if you find something like that, you just talk to your doctor.
And that brings us to our final section, which is honestly the most important takeaway of all. This whole modern approach can be summed up in just 3 words: awareness, not diagnosis.
Seriously, if you remember just one thing from all of this, let it be this right here. The goal is to be familiar with your body. It is not to diagnose yourself. This whole thing is about empowering you, giving you knowledge about your own body, not weighing you down with the stress of trying to be your own doctor.
The best way to think about it is like a partnership. Your self-awareness is a really important tool in your health toolbox, for sure. But it's meant to work with regular medical care and professional screenings like mammograms, not replace them. And it's so important to remember, not every lump is cancer. And believe it or not all cancers even show up as lumps. That's why the bottom line, no matter what, is always the same. If you notice something new or you're just concerned, talk to your doctor. Simple as that.
At the end of the day, nobody knows your body better than you do. And this whole idea of breast self-awareness is just about helping you listen to your body a little more closely. So the only real question left to ask is, what's your body telling you?